I haven't went to the bathroom number 2 in 10 days. Look at my belly. Now, I don't have the urge to go either, and that's what's scary because my stomach don't hurt. I don't have the urge to go, but I'm starting to not eat because I'm literally full of
Did you know that your stool is to the gastroenterologist what your pulse and your blood pressure are to your cardiologist? I always ask my patients, what does your stool look like? Is there any blood? How many times a week do you have a bowel movement? How easy is it to evacuate? Are you straining? How long do you sit on the potty? After you do go, do you feel evacuated? Do you feel light and free like Superman, like you're gonna take off and fly? That's a sign of complete evacuation if you didn't know. It's kind of like the Michael Jackson song playing in the background and you're dancing to it after a bowel movement. That's a sign of complete evacuation. Now, I ask these questions because your stool tells so much about your gastrointestinal health. In my last video, we talked about stool color, we talked about stool consistency, we talked about the alarm symptoms where you need to see your doctor right away. And I'm going to link that in the comments. But today, we're going to be talking about some things that are slightly more exciting. Did you know that your stool consists 75% water? That means you need to drink water to make stool. Remember how much water you need a day? As a woman, you need about 90 ounces, and you actually need slightly more as a man. 90 whole ounces of water. That's 6 small bottles. So, one of my patients came to see me yesterday. She's constipated, she's not pooping well, she's straining, all the stuff. So I asked her, I said, my dear, how much water are you drinking every day? She says to me, Dr. Okoro, I drink a lot of water. Well, you know I didn't stop there, right? I said, well, how much is a lot of water? Because a lot of water doesn't mean anything to me. She says, well, you know those bottles, you know, the 16 ounces? I said, yeah. She said, I drink 2 of those every day. So we calculated, and 2 16-ounce bottles is 32 ounces. I said to her, do you know how much water you should be drinking? She said, that's a lot. I said, actually not. I said, you need to be drinking 90 ounces of water a day. She said, oh my goodness. I said, oh yes. So here's the thing. I explained to her, I said, you know, we're not going to go to 90 ounces from 32 ounces. We're going to do a gradual up titration. Why? Because we want to build a good foundation of habits. If she goes from 32 ounces to 90 ounces overnight, she's not going to be able to sustain that. We want increments. So we decided that she could go from 32 ounces to 48 ounces. I said, can you drink 3 small bottles? She said, yeah, sure, no problem. So she is going to be consistent with 48 ounces of water a day for the next couple weeks until she feels comfortable to go up to 64 ounces. And I'm going to tell you, between that 32 and 48 ounces, there's going to be incremental benefit for her. So we're talking about components of stool, of which water takes the cake. It's the winner. Now you have another 25% of stool, which is the dry weight of your stool. What does that consist of? Did you know that 25 to 50% of that dry weight is actually bacteria? That's your gut microbiome. They live only a couple hours. They're always recycling. They're always regenerating. And so they're heavy. You're pooping them out. What's the third component? Undigested food materials like fiber. You know, sometimes patients will say to me, you know, I ate this and I saw it in my stool. Did you know that your prebiotic fibers, remember the asparagus, the bananas, well, the ones at least that form resistant starch, the oatmeal, the chicory root, the Jerusalem artichokes, these things that are high in prebiotic fiber, they don't get digested in the small bowel like the rest of the nutrients. They actually get to the large intestine and act as food for your gut microbiome. These are the things that feed your gut microbiome, help them produce short-chain fatty acids, help them produce short-chain fatty acids like butyrate that help to regulate so many things in your body. These prebiotic fibers, they also add form to your stool, they add bulk to your stool. An unformed stool is just pitter-patter all over the place. Sometimes when you have an unformed stool, your doctor will say, add some fiber foods or add supplemental fiber. That's because it gets to your large intestine undigested and helps with stool formation. What are the other components of stool apart from water and bacteria and undigested food? Well, other microorganisms like parasites and viruses, inorganic matter like calcium, if you accidentally ate a piece of plastic, well, that's going to be in your stool. And then, did you know that epithelial lining, the one layer of your gut that contains the integrity of your gut and prevents bacterial translocation, that also falls off. It's like a snake shedding its skin. It falls off. The dead cells are part of your stool. Now that we've talked about stool composition and you know how important water and prebiotic fibers are, let's talk about other things that your stool could be telling you. Commonest concern. Dr. Okoro, I made this appointment because there was mucus in my stool. Ladies and gentlemen, wait for it. Sound bell. Mucus in your stool is normal. Did you know that? Your gut lining actually contains mucus. There's mucus on the inside. Why do we need mucus? Did you know that mucus serves as a lubricant? It's like your gut's KY jelly. It helps everything move nicely and move with integrity through the gut. There is a very close relationship between your gut microbiome and the mucus layer, so that there's that perfect amount. When you say you see mucus in your stool, it's because you see an excessive amount of mucus. It's not because the mucus wasn't there initially. Why does this happen? It's when that relationship between the gut microbiome and the mucus layer is compromised. What can compromise that? Infections can do that. Food intolerances can do that. Things that your body just doesn't like, doesn't tolerate very well. Allergies can do that. Inflammatory bowel diseases, constipation and diarrhea can do that as well. And so what happens is mucus production is dysfunctional and you see large amounts of mucus. My dears, if you happen to see an excessive amount of mucus in your stool, here's what you want to ask yourself. Are there any signs of an infection? Are you constipated? Did you eat something that your body doesn't like? These will usually come with clear symptoms. For the majority of people who don't have those symptoms, mucus is usually two categories. An oversaturation due to constipation, you're not moving your bowels frequently, and so when you do move your bowels, it's like, oh goodness, there's so much mucus because it's been waiting to come out and now there's a lot of it. Or people with irritable bowel syndrome, constipation, or inflammatory conditions like Crohn's disease or ulcerative colitis. So that's what your stool is telling you with mucus. Mucus is normal. In certain situations, it can be overproduced, and that's when you see it. What else can your stool be telling you? Well, how about fat in your stool? I have to say that this is not very common. However, if you have a really high fat meal, think that huge burger with fries and all the onion rings sticking out and more wings and more wings and more wings. You just overwhelm your body's ability to absorb fat. When you do that, some of that fat could spill over into your stool. Again, this isn't very common. However, if you do see fat in your stool, it's telling you two things. Number one is that the small intestine that's supposed to be absorbing the fat might be infected, might be inflamed, and it loses its ability to absorb fat. It could also be that the enzyme called lipase, which is produced in your pancreas, is not being well produced. And this can also lead to fat in the stool. So two main categories: lack of enzymes, like occurs in chronic pancreatitis or like a bile duct blockage. Even when the bile is produced, it can't get through to the small intestine to help emulsify the fat. And then diseases of the small intestine. What are diseases that can affect the small intestine? An infection, things like celiac disease, things like Crohn's disease can also affect the small bowel, and so it doesn't absorb as much. Fat in the stool is called steatorrhea. If it happens consistently, you want to call your doctor, make an appointment, have a conversation about that. I want to say a few words about an anal fissure. Why am I talking about this? Because it's really common. In my last video, we talked about blood in the stool being a sign to see a gastroenterologist because it's what we consider an alarm symptom. But so many of my patients this week had anal fissures, I just had to talk about it. What's an anal fissure? An anal fissure is a paper cut in your anal canal. What is a paper cut? What can cause it? Well, think trauma, right? If you're sticking things up in your anal area, if you have a really hard stool and you had to strain, it's going to cause a break. And it's like a paper cut. It tingles, it burns. When stool touches it, it's like putting stool on a cut. Well, it is putting stool on a cut. It tingles, it burns, and you're trying to hold the stool because you know it's going to hurt. Anal fissures can cause some blood in the stool, and they come with pain in the anal area. So if you've been constipated a while, and now you're having burning and tingling down there when the stool is about to come out, it's likely an anal fissure. The other thing that can cause pain and some bleeding is also a hemorrhoid. Now, the difference will be that if there's pain down there, that means there's a blood clot in the hemorrhoid and you could probably see a bulge. And so anal fissures, just a few words about that. I also want to talk about, a lot of my patients have this scenario where today I was constipated and tomorrow I have diarrhea. And then you say, well, are you constipated? And then I have both. Here's what usually happens in situations like that. After you've been constipated for a while, either you haven't had a bowel movement in a few days, or you have had bowel movements that are not completely evacuated. You're having those chunky little stools, maybe Bristol scale 1 or Bristol scale 2. What happens is you're eating every day, you're drinking water, you have bacteria that are dying, you have parasites that are dying. Your body is making stool, but it's just not eliminating. The stool continues to accumulate, but you keep making new stool. Now, stool is in the colon. The colon's only job is to absorb water from the stool. So let's say you made stool on day 20. Now that stool is still in your colon, it's today. That stool, the colon will shrink it by absorbing all the water. So now you have a little hard piece of stool. Now, you made stool day 2, which was 2 days ago. That stool is more liquid. That's the stool that's easier to come out. That's how you have a situation where I used to be constipated, but over the last few days, my stools have been liquid and I still feel bloated because the solid stool is in there. We call that overflow constipation. Well, Dr. Okoro, I'm so confused. So I'm constipated, but I'm having diarrhea. So what are we going to do? Should I take an antidiarrheal? Actually, that's the worst thing you can do because an antidiarrheal just stops everything from moving, and now we're going to have an impaction. The treatment for overflow constipation, even when you're having liquid stools leak out, is to treat the constipation because that's the origin of the problem. How do we treat constipation? We drink more water, we eat more fiber, we exercise more. If that's not working, you should see your GI doctor. She might have some other tricks for you. Other things that your stool could be telling you. Remember we talked about black stools being a possible sign of bleeding from the upper GI tract? Well, you know, I've been burned by this a few times because I've had a patient who came in and I thought, oh my God, they're bleeding. And then I thought, wait a minute. Did you take some Pepto-Bismol recently? They're like, oh yeah, I had some nausea and I've been taking Pepto-Bismol for the last 3 days. Pepto-Bismol can make your stools black. Iron supplements can make your stools black. Black licorice can make your stools black. Acai berries can make your stools black. So if you consume those and your stool is black, that's probably what's happening, as long as you don't have other symptoms. If you do have other symptoms, black stool could be bleeding, you should see your doctor. In summary, mucus in stool is normal, but in large amounts can be seen in anything that dysregulates your gut mucus production, like constipation, diarrhea, and inflammatory conditions. Fat in the stool, anything that decreases the small intestine absorption of fats, like pancreatic disease, gallbladder disease, celiac disease, inflammatory bowel diseases. Anal fissures, paper cut in your anus, commonest cause of pain with a bowel movement, can cause bleeding as well. And finally, overflow constipation. You were constipated and now you're having diarrhea, you're constipated again. That's the liquid stools leaking out, and the way you treat that is to treat the constipation. And then finally, common causes of black stools: iron supplements, black licorice, Pepto-Bismol. That's all for today, guys. I know you just love to look at your stool and what it's telling you, and now you are armed with all this information. Good job, guys. Thank you so much for listening, and be well.